Hello, I'm Marcus Cope, an orthopaedic surgeon who works in the northwest of England. Now, one of the things that an arthritic knee does is what's called creates a fixed flexion deformity. This is where you lose the ability to fully straighten your leg, and this is part of the arthritic process. Now, the problem after surgery when you have your knee replaced is at the time of surgery they will get the leg straight again, but often because of the hamstrings being tighter and the fact that it was habitual walking with a slightly flexed knee, people go back into this same position. So one of the things you have to do is when you're concentrating walking after your knee replacement is to make sure that you thrust the leg backwards, and you should get a pulling feeling at the back of the knee that you've had replaced. This gives an indication that you're stretching out the capsules and the tighter soft tissues there, and will stop you from getting a reoccurrence of your original fixed flexion deformity. Another trick, which was a really helpful thing that a patient told me once that they did, was to use a set of oven gloves over the top of their knee at the front, and in either pocket they put a can of beans. Now this, when the leg's up straight on a small bench or a small stool, allows there to be a continual pressure on the posterior structures and helps straighten the knee out. Unfortunately, you're working against what your natural body's propensity to do, which is to tighten scar tissue up, which is another reason why you drift into a fixed flexion deformity. When I see patients at the 6-week follow-up, this is one of the things that I check for because it can sneak in. People often tend to try and walk with a slightly flexed knee position because they don't like it, because it hurts when they straighten the leg out, and so you have to be very wary of this, and it's a good point to pick it up because it's quite easy to correct at that point. If it's not picked up till 6 to 12 months after the original procedure, it then becomes a lot harder to straighten the leg out. So there are two helpful tips if you've had a knee replacement. Obviously, when the physios work with you, they tend to concentrate more on the flexion because you have to get over 90 degrees of flexion to have what we call a functional range of motion. And this is where how far the knee can bend. It allows you to get into a car, allows you to get into a seated position without people catching your foot when they walk past. I hope that's helpful. Goodbye.